Hi, Wellness Warriors. We have a really great podcast today. We have Dr. Will Cole. He was named one of the top 50 functional medicine practitioners in the country. He's written books on inflammation. And today we're going to talk about intuitive fasting and why it's actually one of the most valuable tools that you can have in your wellness toolkit. It's something that I've done, but never known really how to articulate. And so thank you for this book. It's beautifully written, and you can tell the intention behind it is so pure. And there was actually a little bit of controversy around it, which we're going to also address. And I just think this is a very, very important book and a very important approach. And so thanks for being here, Dr. Cole.
Hey, thanks for having me back. I appreciate it.
Yeah. And let's start with some fun stuff. So the first two questions are just going to be very personal and very playful. The first one is going to be, what's the craziest thing you've ever done in the name of your health?
I'm pretty middle of the road with nothing too crazy. I guess that's subjective, but I've done, this isn't really that weird, but I did hyperbaric chamber. That's not that weird, but I did ozone, hyperbaric. I've done cryotherapy. I don't think it's weird, but maybe some people would.
Well, I don't think it's weird. No 40, like 40-day fast or anything like that.
No Jesus things up in here.
Okay, awesome. And then the second one is, I start this way every time, but people still find it valuable. What do you eat for breakfast? Do you eat breakfast? And if you don't, what do you have patients eat who do eat breakfast?
Yes, for the mortals that eat breakfast. No, yeah, right. I eat breakfast. So I typically, through the work week, what I'll do is I intuitively fast. In the morning, I just feel good when I'm busy consulting patients. I love being in a fasted state in the morning. I'll have a cup of tea. I'll have maybe a cup of coffee, water, some electrolytes in the morning. And then I'll break the fast at lunchtime, which I just did when we're recording this. I just broke my fast. So that's typically what I do when I'm at the functional medicine telehealth center. But on the weekends, I'll typically have breakfast. And what I'll do is I'll do nothing fancy. I'll just do like sort of a fried egg with avocado oil and with some avocados and some ketchup, and maybe like I love the buffalo sauce from Primal Kitchen. So that's typically what I'll do on the weekends.
Okay, perfect. And I forgot to mention before, but you wrote a kind of a vegetarian approach to the keto diet, which again, really appreciate because I just don't feel like there's enough crossover. So you can tell us, we had a prior episode about that, but tell us, how did you become so passionate about functional medicine in general? Just what's your story and how did you get here specifically as it relates to intuitive eating?
Yeah, so I've always been a health nerd. I grew up really being fascinated by this, and then it evolved to me wanting to be formally trained. And I graduated from Southern California University of Health Sciences, which is sort of an integrative health school. So there's DCs, MDs, LACs, DOs, nurse practitioners that are all there kind of learning different aspects within health and wellness and health sciences. And then I graduated, and I in hindsight, it's interesting because I moved back to Pittsburgh from Los Angeles, and I'm from Pittsburgh. So I based here, and I was one of the earlier people writing about functional medicine. And then it became a telehealth clinic before we had the language for it. We just called it a virtual functional medicine clinic, but now it's a thing. So I started one of the first functional medicine telehealth centers. So that's what I've been doing for 12 years. I've just, to be honest with you, it's just always been a passion of mine, and my nose has been to the ground, staying in my lane and focused on what I love and helping people through this exciting field of healthcare. So I don't know if that answered your question, but it's sort of like a health nerd gone wild.
No. No, I love it. And something I appreciate about your approach is that it's so uplifting and so individualistic, and there's not dogma. And I don't know. Yeah, I really appreciate it. So I'm glad you went through all of that. I'm glad you pioneered the telehealth clinic and all that. So intuitive fasting. I remember when this book came out because I heard of it and I thought, yes, that is what I've been trying to do. And then initially I saw that there were at least some people who were like, no, what is this? What does he mean? And we're kind of triggered by that. So define intuitive fasting. And what I do know is the people who were triggered, we're not reading this book because it's like the most wonderful and warm book, and empowering. One of the most empowering books I've read this year. So what do you
Thank
mean
you.
by intuitive fasting, and why are people so resistant, at least initially, to the concept?
Yeah, I think it's a sign of the times in many ways, right? It's like our culture is addicted to being triggered and addicted to being offended. And it's like we have very little resilience to anything different than our own toxic tribalism. So
Mhm.
I think that that's really a testament, not to just this book. This is a very small example of our bigger cultural problem and fragility that we have. But I think that the book itself, like you said, it's a very middle of the road book when it comes to fasting. I mean, I'm by no means an extremist or that out there. I'm just looking at the research, but it's born out of my clinical experience, right? It's just like any ketotarian when I wrote that, or the inflammation spectrum. And this is no different. Intuitive fasting is just what I've seen 12 hours a day for the past 12 years of just seeing what works, what doesn't. And it's the message is just this seemingly dichotomous thing, intuition and fasting, but that's the heart of functional medicine. It's the science and art of wellness. And I think that that's where sustainable, positive, healthy changes reside. It's balancing the science and the art of wellness. And that's, my podcast is called The Art of Being Well because of that, because it's just really finding out what your body loves, finding out what your body hates. So it's really the message of functional medicine. And it's a play on words, obviously, with the prefix int of intermittent and intuitive, but it really is just something that I've always talked to my patients about. And we talk about this intuitive component to fasting and an intuitive component, mindful component to food and to eating. So that's really what it is. It's empowering people with the science of fasting, which is so exciting, the health benefits of fasting, but finding a way to strike a balance that works for you sustainably. So that's where the intuition comes in.
Yeah, it's beautiful. And I can't wait to get into the benefits of fasting. We're going to go there in a second, but I wanted to say that there are so many different fasting protocols. And a lot of times when you get started, you try and put yourself in that box. But what I love that you're saying is you can't be put in a box, nor should you be put in a box. And once you learn the training wheels of fasting, you can change it at different points in your cycle, change it in different parts of your week, in parts of your year. And that is absolutely what you have to do. It needs to be a dynamic thing. And so I was so appreciative that you did that. One thing I want to do before the intuitive fasting is this whole intuition piece. I think a lot of us have lost touch with that,
Yeah.
kind of disembodied and disconnected. And so how do you feel that fasting can actually bring us back there, or do you?
Yeah, I mean, I think, and that's the word I think that really upset a certain group of people. To answer the first part of your question previously, it's like there was the eating disorder
Yeah.
community and the intuitive eating community, capital I, capital E. It was a book in the 1990s.
Yeah.
And they, in their minds, that is like the only intuition is their little book from the 1990s. The reality is I'm talking about the human intuition. And that's the other problem with our culture. We make everything about ourselves, and wasn't about them. And if they would know, if they read the book, like you said, I mean, the ultimate cliche, judging a book by its cover, they did not read it. Because in the first couple pages,
Yeah.
I say, this is not for people with eating disorders. Talk with your eating disorder specialist, talk with your doctor.
Yeah.
This is for everybody else that's struggling with metabolic inflexibility, with different types of inflammation, with blood sugar problems, with weight loss resistance, with fatigue, with digestive problems. Those are my people. Those are the people that I'm helping with clinically. That's what the book's for.
Yeah.
So really to learn about what your body loves and what your body doesn't love. So metabolic inflexibility, like I mentioned in the book, that's the death of knowing what works for your body and what doesn't, because your blood sugar is all over the place. Your hormones are all over the place. Your gut-brain axis is not communicating properly. The vagus nerve is not properly optimally functioning. So you're left with a sense of disillusionment and food confusion. And you're like, what's up is down and what's down is up. And your body, is it intuition or is it hangriness? Is it intuition or blood sugar imbalance? Is it intuition or insatiable cravings? I mean, stress eating isn't intuitive eating. Stress, these are the things I'm talking about in the book. But when you gain metabolic flexibility, meaning you get blood sugar balance, you calm inflammation, you are more fat adapted or keto adapted, that is a tool within the functional medicine physiological toolbox to calm the noise in the body, to actually hear that still small voice of your intuition and your awareness of what works for your body and what doesn't. So fasting is a tool. And the analogy that I use in the book is sort of this proverbial yoga class for your metabolism. So if somebody has never done yoga before, maybe their hamstrings are tight and they're, very like tense. They could go to that yoga class and say, man, yoga is not for me. This is super difficult. This is not, there's nothing like nice about this. But it's not yoga's fault. It's their own musculoskeletal inflexibility. And that's what fasting is. It expands and contracts the metabolism to become more flexible. And at the beginning, fasting will not be intuitive because you're metabolically inflexible.
Yeah.
That's why you need to be doing it. So when you gain flexibility, then like you said, like you didn't have the words for it, but you were already doing it. So anybody that really practices these tools will know there's no hard and fast, dogmatic, obsessive, restrictive way to go about this. That's not the right way to do it. That's not the healthy way to do it, mentally and physically. But if you really find this art of fasting or the art of wellness, I think that's really where the magic happens.
Yes, absolutely. And we have been told by processed food companies that we need these 3 square meals a day, and we need to, there should never be times where we're not close to food. And we are paying a price for that, unfortunately. And fasting, historically, all religious cultures, I mean, people have been doing this for so long. And so this is definitely something, I was that person riding this roller coaster. And when you do not have homeostasis, your body seeks it. Okay. So we're using all of these resources just to come back to the center. And then we don't have energy for other things. So we're at the mercy of our physiology, whereas we can actually balance the physiology and use this beautiful energy for something else. And so I thought that was what your book was about for me. So let's get into those benefits of fasting. There are many, and you lay this out beautifully in your book, but what can people expect to gain from fasting?
So I love what I really tried to put in intuitive fasting is using fasting as both a medicine and a meditation. So like the meditation part is like the intuitive side, right? That's like the heart side of using fasting, like you said, for other things, a mindfulness practice, really using it during meditation, using it with forest bathing and going out in nature. And like really, like you mentioned, humans would have done fasting as a part of a meditation or a spiritual practice for thousands of years. I mean, in Judaism with Tisha B'Av and Yom Kippur, Islam with Ramadan, Christianity with Lent, indigenous tribe societies around the world, all have used fasting for meditative purposes, spiritual purposes, and also for health, physical health purposes. So the other side of that coin of using fasting as a medicine, before we even had the research around it, you look at historically the early days of fasting in medicine, traditional medicine. Hippocrates, the father of modern medicine, he used fasting for his patients. Paracelsus, he's known as the father of toxicology. He was in Switzerland, I think, in the late 1400s, early 1500s. He called fasting the physician within, which I think is a eloquent way of putting it. Like, he didn't have the randomized controlled trials. He didn't have the double blind stuff. He just knew, man, this really improved people's lives. This inner doctor, this physician within. And now research is catching up with good old Paracelsus, that we now have the science and the mechanisms and the pathways to understand, where does the health benefits come from? Where do they come from? And largely, it's allowing our body to have a break, right? So much of our body is in this sympathetic fight or flight stressed state. And I think it's a wonderful break, that because digesting food, albeit very important, we would be dead without it, but it still requires a lot of energy. So it's the yin and the yang, and we have to look at both food and fasting as two different amazing medicines. And we need to sort of use both of them to our benefit to live a long, healthy, and vibrant life. So fasting is a great way to repair, a great way to heal and to rest, and to allow our body to work on healing and not just digesting food. And so it's not just like we can look at the foods that we are eating in our modern world today. So that's a problem. But then it's how much we're eating of it. It's how often we're eating of it. And we're really giving our body not much of a break at all. So that's a powerful tool to give your body time to respond. And look, and then there's even deeper aspects of fasting when it comes to like ketosis and that signaling molecule being a component to why fasting is so healthy, because it is an epigenetic modulator. It's really working on inflammation. It's working on brain function. It's working on metabolism function. It's working on gut health. It's doing a lot of things. That doesn't mean everybody that's intermittent fasting is always in ketosis. So there's different levels, I think, of the therapeutic benefits of fasting. On one level, it's a break. And then on a deeper level, there's some ketosis involved, depending on what the person's eating and how long they're fasting for. And that's why I don't ever recommend someone to fast their way out of a poor diet. And I never would recommend that. And it's really paired with a nutrient dense, whole food based diet where people can really amplify the benefits of both food and fasting, because they really are harnessing the power of both.
Beautiful. And I know that, like you said, it can be a meditative experience. Like we're having a break, we're kind of channeling our calm. But I know also that it's a physiological thing that I experience too when I fast, that I just feel calmer. And I know there's like some GABA that could be happening. Or can you talk a little bit to the brain benefits specifically?
Yeah.
Because I think they're so powerful.
Oh, absolutely. So I mean, fasting and ketosis, and I think that part of the research is really looking at both, because the ketogenic diet and fasting, the ketogenic diet is fasting mimicking. So a lot of you'll oftentimes you'll see some similar mechanisms studied both in ketogenic diet research and in fasting research, because it's really beta hydroxybutyrate, this signaling molecule. I mean, ketones are known as the fourth macronutrient in the research. So we have proteins, fats, carbs, and ketones. So it's a way to fuel your body, and it passes through the blood-brain barrier. It works on these pro-inflammatory pathways that impact not just the brain, but impact the body systemically too. So things like the NF-kappa B pathway, things like the NLRP3 inflammasome, they're lowering it. It's increasing these antioxidant pathways, longevity pathways, things like autophagy or cellular recycling. It helps to really help the brain in many ways. It also improves BDNF, brain-derived neurotrophic factor, actually encouraging the production of healthy new neurons, which is really exciting, and improving neuroplasticity, which is all around that sort of topic. So there's a lot of far-reaching neurological benefits to fasting. It's just, in a way, in short, it's just like a time for that inner physician to make your brain strong and resilient.
Yes. And I love that too, because I think today a lot of people feel they need to outsource that ability to heal. Like we need someone else to come in. And what you're saying is the body with it, they know, give it what it needs, take away what it doesn't, and magic happens. I just wanted to say too, that Dr. Dale Bredesen, UCLA, he actually uses a keto flex kind of situation where at least 12 hours of fasting and then a keto type approach. And he's actually the first person to reverse Alzheimer's in clinical trials. So that's pretty darn exciting and just speaks to the power of ketosis and fasting for the brain. So talk about this. So intuitive fasting, that means there's a lot of different ways that we can fast. So can you talk about some of the more powerful fasts that you use in your practice? Are they long? Are they short? How often are we doing them?
There's a place for multiple day fasts, if it's clinically appropriate. If I would typically recommend it being supervised by a doctor in functional medicine or some coach that's trained appropriately and monitoring everything for these multiple day fasts. The type of intermittent fast that I explored in intuitive fasting is one that I feel the reason why I explored it is there's a lot of research around it, but also it's very accessible for people, meaning it's called time restricted feeding, or TRF, or time compressed feeding. And it really doesn't involve any caloric restriction. That's another sort of misconception with this. It's not caloric restriction, which is what a lot of people think it is. Oh my gosh, it's just like eating disorder disguised as a wellness practice. It's not it at all. It's just very intentional about when we're eating and putting our food intake within a period of time, within a day, but still eating nutrient dense, whole food based diet every day. So the way that I put the protocol in the book, it's these vacillating, ebbing and flowing eating and fasting windows. So in week 1, we start with just a 12-12, which is very accessible. And that was another one. I had to laugh when I saw it through social media when the book came out. It was like, the only fast you should do is fasting through the night. And I said, well, if you would have read the book, that's but what week 1 and week 4, actually 2 out of the 4 weeks is what I'm actually telling you to do, you freaks. So so I agree, like allow a couple of hours after dinner before you go to bed to allow your body to fast through the night until you break the fast at breakfast. So you're pairing that with this nutrient dense ketotarian sort of Mediterranean with some omnivore option ketogenic foods to leverage the benefits of ketosis, this physician within this fasting mimicking state when you are sleeping. So that is week 1, what I call that sort of the metabolic reset week. And then the body reset week. Week 2 is the metabolic recharge week. So that is a 14 to 18 hour fast. So I'm having people over that week play around with it, see how their body feels. Maybe take it a bit slower if you're new to this. Dig a bit deeper to 18 hour. So about a 16-8 or an 18-6 fasting to eating window, which the reason why I'm calling the body reset, it's really looking at the sort of the gut component of it and the microbiome circadian rhythm research. Week 2 is metabolic recharge, all the cardiometabolic research, and really showing the 18-6 and the 16-8 being a tool within the toolbox. Week 3 is the cellular renewal. So that's a 20 to 22 hour fast. So it's an almost OMAD fast, but it's every other day. It's not every day. So there's a refeeding day of 12-12 interspersed every other day too. So there's a OMAD refeed. But again, it's an almost OMAD is a bit more flexible than that. It's about a 2 to 4 hour eating window. Because I look at the research and I talk about the research in the book of the PKR pathway, if you try to get your calories in such a tight window, it doesn't work for everybody. Some people do great with OMAD. I don't want to dog it, but some people, especially people that are newer with exploring an OMAD approach, it's better to kind of buffer and give a bit of a longer eating window, especially if you're eating healthy, nutrient dense foods. You kind of need that to digest things appropriately. So right. That's looking at autophagy and longevity and all of that research. And then week 4 is the back sort of the hormonal rebalance week. So it's back to 12-12, but with more clean carb cycling. So you're not always in ketosis. You're not always in a deeper fast. That's that proverbial yoga class for your metabolism. So people can cycle through those as much as they want. And that's going to do 2 things. One, it's going to therapeutically improve their metabolic flexibility. Their body's going to feel a lot better, but they've also used fasting as a meditation in the sense of they were intuitively checking in with their body. And I'm teaching them through the book to adjust it in real time to see how their body feels. So after maybe 2 or 3 cycles of this protocol that's in the book, they're going to learn, oh, I felt great when I did that, but I didn't feel as good when I did that. So I'm going to do a little bit of that, like a little bit less of that next time. That's the art of what I'm talking about here. That's the intuition. So you will end up evolving the protocol completely tailored to you because you've been mindfully doing these things. And that's the ultimate goal of the book, is for you to intuitively evolve it for you.
Yeah, it's beautifully written. And I love that we start slow and we push a little and then push the most, and then we go back. And so for 2 weeks out of these 4 weeks, we're only doing 12-hour fasts. It's basically the dinner to breakfast. Yeah. And yet, I don't know. And you have a 14 to 18 hour window. Like you said, you're just learning, this day it works for me and tomorrow it's not going to. And that's totally fine. So I got to get your opinion on one thing before we talk about the differences between men and women. So you talked about caloric restriction, and there are people out there who believe that fasting is only beneficial when it also induces caloric restriction. So you don't agree with that? What is your take on that?
I think it's part of it. I think, and there's some studies kind of show that could be part of it for some people, because people are eating too much oftentimes and not too much of the right foods. So I think, some of the benefits could definitely come from a slight caloric restriction temporarily, right? But I do feel like it's so much more than that. And all you have to do is really look at the research around ketosis to understand that, and the ketogenic diet to understand that. It's way bigger than just calories in, calories out, that sort of concept. This is that inner physician state, this act of ketosis, which fasting will upregulate, it will support. So it's not just one reason of why fasting works. Yes, the caloric component would be a component to it, but it's not the totality of why people see the benefits.
Beautifully stated. Okay, I love that. And for women and men, this is a common thing. And you have this beautiful intuitive plan. And then we have our women's cycles that we lay on top of that. So can you talk about the differences in fasting for men and women, and at what point in the cycle you would start this or not start this, if in fact that is part of your approach?
Yeah. So there's a whole chapter devoted, that's because you read it already, but
Yeah.
for week 4, the hormonal rebalance week, that's really what the conversation's around.
Yeah.
It's not just female hormones, but all, cortisol and thyroid hormones as well. Because look, what fasting is a hormetic effect. It's a good stress, and that's a good thing. I mean, it's just like cold therapy or, cryotherapy that I talked about earlier, or saunas or high intensity interval training. I mean, these are all good things. But no one would say, stay in the cryotherapy chamber for forever. And that's more is better. No, you would freeze to death. Or to stay in the sauna forever. And like, that's the best. More is better with saunas. No, that's crazy. And same with high intensity interval training. No one's saying, do HIIT training 24 hours a day and never stop. That's crazy. Fasting is the same way. It's more isn't always better. But striking a balance to find the therapeutic benefits without falling prey to the potential pitfalls of doing it too much or abusing it or doing it in a way that's not appropriate for your body. That's really where the intuitive component of it is. So these are acts of good stress. That's part of why the research is pointing to it being beneficial, just like all those other therapies that I talked about. So too much hormesis, too much good stress in the body can impact hormones in different ways, especially if you're a cycling woman. The fluctuations of estrogen and progesterone is going to be meeting this hormetic stress. And that's why many women, even if you talk about high intensity interval training, that's why all exercise is different, right? And we don't say exercising is bad, like you should not do it. No, you should just find the right exercise that works for your body and be smart about it and start off low and slow and really be intuitive about all these practices within wellness. And that fasting is no different with that. It doesn't mean it's all or nothing and saying women that are cycling cannot do this, but I recommend more of a cyclical, flexible approach that you adjust not just throughout the week or throughout the month, but also specifically if you're a cycling woman to do it around menstrual cycle. Now, the question here is, and this is sort of the criticism that fasting gets, is like, well, women shouldn't fast. But that is a very interesting statement, because who are we talking about? Who is she? Because there's a lot of different women, types of women out there that are going through different things in their health. So that's a very reductive statement to say, well, women shouldn't fast, because is she going through insulin resistance, chronic inflammation, an autoimmune problem, or isn't she? So it's like the way that fasting interplays with someone's physiology is so different regardless of gender. So it's just important for you to say, because I see many women that are cycling, that are menstruating women, but they have all those inflammatory metabolic issues, and they do not need to do a cyclical fast for a while, meaning they're tapping into that physician within, and they need to a little bit more because they are therapeutically needing to get the benefits of the state. But then eventually in the maintenance phase, once they've hit their goals, then they go through the cyclical sort of maintenance approach. But maybe she doesn't have those problems. So a cyclical approach would be appropriate right out of the gate, because too much of a good thing isn't good anymore. So that's why I recommend lighter fasts. I go back to that 12-12, maybe increase those clean carbohydrates like sweet potatoes and fruits, and even like gluten-free grains if you tolerate them, around your period and around ovulation, to really leverage the benefits of bigger refeeding window and clean carbohydrates from whole food sources to support progesterone, support estrogen. So that's really what it is. And that's back to that whole intuitive sort of concept, is that there's no hard and fast, broad sweeping, generalized rules. Let's find out what your body loves.
Yes, perfect. I love it. And on the heels of that, and acknowledging that, what I thought was interesting about your book is day one. So the first day when your period starts, you mentioned maybe increasing carbohydrates around that period, and maybe around ovulation or a few days after. And in my experience, it's the week before where it is clear for me that I need to do it. Is there a reason or something you're seeing clinically that made you recommend when your period starts as opposed to the week before?
No, and that's a good point. I think that even that needs to be looked at. Is where do you feel the best? Like when you're checking with your body, and like that quiz that I put in the book, that's adapted from questions that I ask patients. I want them to kind of learn about their own cycle, and every woman's cycle is slightly different with how they feel. So some women will feel better with increasing those clean carbohydrates the week before, certainly. So there's no hard and fast rules with when that clean carb cycling should happen. It's just when I want them to experiment with it, give it a try one way, and then the next cycle, try it a different way. And I give some pointers in the book.
Yeah, he does a great job. So let's put diet in there. You're talking about clean carbohydrates and carb ups and more carbs, but what do you think are some of the most important dietary points to follow in this fasting lifestyle?
Well, I put it mostly with a flexible ketogenic approach most of the month. So you can really, again, mimic fasting while you're actually not fasting, because most of these fasting windows aren't super aggressive. So I really wanted to bring both of these tools within the toolbox, both flexible intermittent fasting and the ketogenic diet together. So lots of healthy fats, obviously wild caught fish, avocados, olives, soaked nuts and seeds, grass-fed beef, lots of produce. I always thought this is interesting. And I've seen this like throughout my years as like the concept plant-based. You could look at like a really solid, like someone that does a paleo diet really well, someone that does, the ketotarian diet really well, that's not fully vegan. They're some of the most plant-based people that I know. Yeah. And it's so funny. You look at a lot of vegan foods out there. It's like there's not really much plants going on there, a lot of processed food. So now you could do a clean version of vegan diet and a clean version of an omnivore diet. So that's what I would advocate people as being really diverse with their foods, nutrient dense with the foods, and having lots of plans, but doing it in a way that works for your body and not being, a carbitarian, being is completely addicted to sugar. So yeah, that's really what I think. And then clean carb cycling is about 75 grams to 150 grams of carbohydrates. We're increasing things like sweet potatoes and fruits and gluten-free grains, like I mentioned, if you tolerate them, or like pressure cooked legumes can be brought in as well for some people. So I wanted people to have as much variety within the realm of whole foods to really use them appropriately. It doesn't mean you always eat one thing all the time. You're just looking at the tools within the toolbox. And I wanted to educate people on how these foods fuel their body, just like fasting can fuel their body.
Love it. So if we're on a 75 to 150 gram carb up period, is that like once a month we do that for a week, or we do it every other day? Or is this just a very intuitive thing for you as well?
Yeah, well, the way that I did it in the protocol was really in week 2, I allowed some allowance for a moderate carb increasing. And then in week 4, they were a little bit more. So it was a few days, let's say 3 to 4 days out of the week in week 4. So there really wasn't that many. And then I allowed, like I implored that anybody that was a cycling woman that was reading the book to also do extra days based on her cycle. Yeah. So yeah, a few times a month for most people. Some people can end up intuitively as they cycle through this protocol a few times, they may do it weekly. They may find that, well, I'm going to moderate my carbs most days out of the month, and that's where I feel good, but I'm still going to intermittent fast. That is part of it too. So I'm not saying everybody has to go lower carb majority of the time to get the benefits of fasting. Fasting stands on its own, even if you're not in eating a ketogenic diet. I just think they're two tools that work really well together.
Absolutely. And I like to do it kind of on the weekends or my more carb up periods, because I feel like life just kind of, that's just what happens. And during the week when I'm working, it's super simple for me not to do that. Yeah. So I'd love to know, now that you are clearly seasoned, what is your kind of routine look like fasting wise?
Yeah. So I've done the protocol in the book, and honestly, the protocol in the book as a clinician, it's one thing, because I'm looking at labs, I'm looking at patients' health history and all that stuff, right? So, and then I can clinically monitor them and coach them. But as I was reading the book, I thought, okay, if I'm not there managing this and adjusting this, like how can I do something to really set them up for success and walk them along with all the questions that people get, right? That people ask me. So that's the protocol is really geared towards things I've seen work really well clinically and things I've done on my own too. So what I do, I will randomly just do the cycle, the protocol in the book, the 4-week flexible fasting plan in the book. But I'll say this, my average go-to is most of the week when I'm consulting patients during the week, I'm doing an 18-6. I will occasionally do an OMAD day, like the week 3 in the book. So I'm basically through the work week vacillating between 2 and 3, week 2 and 3, an 18-6 and an OMAD. And then on the weekends, I'm doing maybe a 12-12 or like a 14 or a 16. I normally will allow a couple of hours before I break my fast at breakfast, but it's nothing to, maybe 14, maybe 15 hours on the weekends. So it's really what I do. And then press repeat on Monday.
I love that. And that's very similar to what I do. I find Monday's a really easy day for me to do a 24-hour one if I'm going to, because I'm really busy. I'm trying to get back in the swing of things. And I've usually, indulged on the weekend. So I'm very satisfied. And then, like you said, 16 to 14 hours the rest of the week, and then kind of 12. I love that. That's beautiful. Now, the other thing I really appreciate about your book too is foods that enhance autophagy. And you have a tea habit that you love. So you talked about some of the teas you use, but like, what are some tools that we can use when we're not eating that still makes life interesting and comforting? Yeah.
Oh my goodness. That's a great question. There's a whole section in tea, which I told the publishers, Penny Random House, they're probably like, why are you writing about tea in a fasting book? But it's like one of the best tools, I think, one of the best fasting tools, because it's fun. You can get different tastes. It doesn't break a fast. You can get a lot of therapeutic benefits from it. It's 0 calories. There's so many cool things about tea. So I've loved tea when I'm fasting or not fasting. I love tea, but I really will have typically a Earl Grey tea in the morning, or a tea that has added bergamot, which is the citrus from Calabria in Italy, typically. And it's been shown it's a polyphenol, basically a citrus polyphenol, and it's been shown to support autophagy pathways, decellular, anti-accelerated aging, anti-disease pathways, these cellular renewal pathways that fasting also supports. So it's, in a way, I think, like leveraging the benefits of autophagy or supporting it in a different way, both through fasting and drinking the tea. Plus, it has some caffeine, it has L-theanine, it has the catechins from the actual tea itself. And then I'll have, like at lunch, I'll have some green tea. And in the evening, I'll have like a caffeine-free tea. So that's what I have, but I'll have lots of cups throughout the day. They're just sort of a spectrum of tea.
Of caffeine.
Yeah, I probably drink a little bit too much tea, but I feel great on it. I feel great. I don't feel jittery at all. And I think that's one of the benefits of L-theanine paired with the catechins and the caffeine. It tends to be less like jittery than coffee is. So that's what I'll have. Yeah, there's a whole tea section in the book because I think it's probably the best. Between tea and added electrolytes, I think are the two best fasting things to drink.
Yeah, that's what I was just going to say. We're going to get into a few supplements, but I loved it. And you have little recipes for like your bergamot with like a little coconut oil and MCTs, which have benefits all their own. And yes, we're going to say you got to get this book because
London Fog. That's the fasting London Fog.
Yes.
In that book. Yeah.
Which I loved. Is amazing. And okay, so let's talk about you'd mentioned electrolytes too. Are there things you think people need to be supplementing with if they're fasting, and which supplements are kind of breaking the fast? And give us that.
Yeah. So as I mentioned, the electrolyte supplements, or even adding in some Himalayan sea salt or Celtic sea salt to water and sipping on that throughout the day. One of the, like, that meme, like, coconut oil solved like 99 problems, like something like that. I have 100 problems, and coconut oil solved 99 of them. I feel like when you're fasting, if you have 100 problems, electrolytes will solve probably 99 of them. Because I tell you what, when I'm talking to patients, I sound like a broken record. I'm like, if you do this, and then invariably it solves most of people's problems because they're not eating all the processed foods anymore, and a lot of sodium has gone away. And their electrolytes, even just the fasting and ketosis, that could throw off their sodium and potassium and magnesium. So bringing that back in the form of, you could obviously add sea salt to your food, which will help. But I find that higher doses of it, especially at the beginning, is very helpful. So if someone's struggling with cravings or tiredness or brain fog or sleep issues, try the electrolytes. I'm not saying it's going to solve everyone's problem, but it's definitely up there.
But pretty close.
Yeah.
Okay. And if they're like, this is something that I talk, if they cannot push any longer physically, or they are getting to that point, would you say coconut oil? Would you say
Yeah.
MCT oil?
MCT
What's
oil.
a way you push through?
Yeah, I think that's a great point. And like, that's sort of the conversation of like, well, that's a very common question. What breaks a fast? What can I get away with? Can I add my almond milk to my coffee? Can I add the MCT oil to coffee? So I would say it's best to say something with no calories would be ideal in theory, right? So your digestion's not being stimulated at all. You're giving your gut the biggest break. But then I think it's a gradient from there. It's like a spectrum of from there. Because after that, after no calories, like let's think like salt water and electrolyte water and tea and some black coffee. And then from there, it's all right, what's something that's not going to impact insulin and not going to impact mTOR, which is the mammalian or mechanistic target of rapamycin, that sort of pro-longevity pathway that, well, by lowering mTOR, it's supporting pro-longevity pathways. So that is where fats come in. Because if you don't have carbohydrates, and if you don't have protein, which mTOR is very sensitive to protein, then you're left with fats. So it'll stimulate digestion, but you're talking about a small amount of it too. So calorically, it's not going to really be impacting the fast, and it's not going to impact insulin or blood sugar at all too. So yeah, MCT oil, which is typically from coconut oil, right? So it is a good source to have, and it can make your fast easier. And if something makes your fast easier and you can go a bit longer and it makes it more enjoyable and sustainable for you, then I think it's a great tool without having the toolbox. And like I mentioned, like that fasting coffee or the fasting London fog with the Earl Grey tea, those have MCT oil in it too. I typically would say someone could use it as a tool as if they're newer to fasting, or for anybody upon preference, like whenever you want to, or towards the end of the fast. I find it to be one of the best places to put it, where it's like, okay, I really feel like I'm going to break my fast, but now if I have this, I'm good for a few more hours. I'm good.
Yeah.
And I find that's a great little tool to bring in.
Absolutely. I've noticed that too. Or when, I'm coming off of the vacation or some other point where I was definitely overindulged and I need a few training wheels, it definitely helps. Now I have a few subscriber questions, but first, the last thing I want to ask you about is I have women who come to me who are genuinely very scared and they think that they don't need to fast or they shouldn't be fasting. And I think it's mostly in their head, maybe from culture or whatever, but how do we in those moments kind of push past and get out of our own way? Or do you think there are certain people who shouldn't? So
yeah, I think there are definitely people that shouldn't. And I talk about them in the book. I think if someone has a eating disorder, a history of having an eating disorder, get the go ahead from your doctor and eating disorder specialist. Because I will say this, there are countless people within the eating disorder community that have messaged me since the book came out and told me, I can't even speak about this out loud, but fasting's helped my health so much, but I would be ridiculed by the community because they're so tribal about this stuff and negative, and they one size fits all. So it's really sad because there are people that get the go ahead from an eating disorder specialist and doctor, and they're through their recovery, and they use flexible intuitive fasting to really help their blood sugar, help their cravings, help their inflammation levels. So it's not to say that people that have a history of eating disorders can't fast. I just want to be smart and appropriate about it, and for them to get the go ahead from their doctor. So, I mean, that's a nuanced conversation, but I would say definitely those are some people that should be mindful of it. And if it's ends up being like a source of stress or shame or obsession, then definitely you should not be doing this. This is the antithesis of why people should be fasting, which is really an act of self-respect and wanting to feel better, not worse about yourself. And obviously the general advice for anybody that's pregnant, I really would hold off on starting fasting during pregnancy too. That's not to say that someone that's a fasting aficionado couldn't do some light time compressed feeding because there's no caloric restriction. So, those would be two groups of people that I would say more than anybody.
Perfect. And we did have a subscriber question, and one of it was relating to pregnancy, but they were someone who's been fasting for a very long time, a 16/8. And if I'm understanding you correctly, as long as we're not cutting back on calories or missing out on important nutrients, it could be okay. You're not saying that it is,
Yeah.
but it could be something, a conversation to have with your doctor.
Have a conversation with your doctor. They know your health history. But yeah, an 8-hour eating window for someone that has no problems, that's healthy, that's been fasting for a while, that's plenty enough time to get nutrient dense foods and eat appropriately.
Yeah. And what about nursing? That was another one of the questions.
Yeah, that's one thing that I wouldn't start when you're about to nurse, especially if your body is making changes. And look, we are supporting detox pathways. So if somebody's really going to upregulate detox pathways, it's not necessarily the best time to be supporting detox pathways so much. It's such a gentle, natural way to support detox pathways. It's nothing artificial, it's nothing aggressive. But generally speaking, talk to with your doctor. Again, I don't think it means you can't do it, but I would just be more mindful of starting anything like that when you're just in that season of your life. When you, for anybody, you want to make sure that's breastfeeding. Obviously, you want to make sure that calories and nutrition is optimized. Now, the way that we're doing intermittent fasting with time compressed feeding, it's not caloric restriction, but any change to your lifestyle could impact production, and that may not be your top goal at this point of your life. Focus on food for now, and we can lean into fasting later.
Yeah. Okay. And my final subscriber question regards losing lean muscle mass as a result of fasting. Is that
Mhm.
something that happens later in life? And if it is, how do you kind of mitigate that?
It can happen, certainly, especially if somebody's fasting too much and not eating enough food when they are eating. So be mindful of protein intake, be mindful of calorie intake, and make sure you're getting enough of the essential amino acids. And I find that some people, when they're fasting or they're changing their foods up in general, sometimes they can be unintentionally hypocaloric or missing out on nutrients that the body needs. Now, metabolic flexibility and ketosis is actually protein sparing. You actually preserve lean muscle mass if you're doing it appropriately. So I would say, yes, that's a potential pitfall, and I want to avoid that. But it doesn't mean you can't fast. It just means you want to be able to make sure that your essential amino acid and your caloric intake is enough during your eating window. And then check in with your body. You may just be fasting too aggressively. You may want to loosen up and be a little bit more flexible there.
Okay, perfect. And before we talk about where we can get your book, I just thought of another question that I have for you, because you're such an open and non-dogmatic person. When it comes to protein quality, whether it be plants or from animals, do you notice a difference in terms of outcomes, health outcomes, or do you feel like they're relatively interchangeable?
No, I mean, I would recommend people to have a more of an omnivore approach, landing on a sort of Mediterranean ketogenic approach or a Mediterranean approach if they do more wild caught fish and then some plant-based protein options like organic, non-GMO, like tempeh or natto or tofu that's organic, and legumes that are pressure cooked. If that works for them, they could still be predominantly plant-based with some wild caught fish and maybe some egg protein. That could be sufficient for them. But look, I'm always weighing the point of this is, again, the science and the art of it is what's someone's preference and what just works best for their body. And sometimes a lot of these plant-based proteins, they don't work well for people's digestion or their inflammation levels or their blood sugar. So at that point, it's just like we have to have a conversation. This is what I do clinically, of saying these sources of, to use the example of protein, aren't working for your gut health or inflammation levels right now. Let's see what your body actually does love. So it's not just about the protein bioavailability. It's also about what their body best digests, like what actually irritates their digestive system or not. So these are the weird things that I think too much about, but I have to think about it for every individual person.
No, and I love that you do, because I was actually incorporating more pea protein this last few months, and I have this tenderness that all of a sudden in my cycle that I hadn't. And so,
Uh,
yeah, I think you can, like you said, I'm not attached to any one dietary approach. I think you got to find what works for you. But like you said, sometimes you have to be really aware that what you want to do isn't always
yeah,
what your body wants you to do.
exactly.
So thank you, Dr. Cole. This has been amazing. And like I said, I thoroughly loved your book, and it articulated something that I couldn't, but was wanting to and practicing myself. So thank you for giving me a vocabulary. Now, where can people connect with you and learn more about your work?
Thanks so much. Everything's at drwillcole.com. That's drwillcole.com. That links to all the books are there. The telehealth clinic, there's videos, the podcast, all this stuff is on the site.
Yeah. And you should follow him on social media too, because you're such a voice of reason and positivity and empowerment. So definitely do that.
Thank you.
Yeah. And do you think that we missed anything? Are there any famous last words?
No, this is an epic conversation. So you're great at this. In this day and age, everybody has a podcast, but very few people are actually really good at it. And you are one of the people that are extremely talented at running a podcast and making it flow well. So thank you.
Well, thank you, Dr. Cole. And we'll do it soon when you write your next book, which I'm sure is coming. Okay, thanks.